Welcome back. We have a gentleman on, Paul Olson from Medtronic. He's a representative with them. And they have devices, I guess, that deal with venous insufficiency. So first of all, welcome.
Thank you.
Nice to have you here
Thank
today.
you, Ken.
Let's talk about first Medtronic and then what these conditions are and how can people figure out that could be what they have.
Sure. Well, Medtronic is a, well, first of all, thanks for having me. Medtronic is a worldwide company that has devices for the treatment of all kinds of conditions.
Okay.
Today I just wanted to focus on venous disease and varicose veins. And a lot of times people think varicose veins is just a cosmetic nuisance. And it's not really a significant medical condition, but it can be a sign, as we'll see, of a more significant condition.
Okay. What is it exactly? We got something on the screen here that we can look at, and I think we all know what varicose veins are, and maybe some people who get that, I don't know if for some people it's just a temporary condition, but how does it go from maybe varicose veins that maybe just a small nuisance to heightening to insufficiency of the circulation, I guess, right?
Yes, yeah, well, it's a good question. And it's
So
basically
that's
over time, as you can see, is a progression where the condition will start out as varicose veins, or you may not even see the varicose veins. It may just be leg swelling or heaviness, itchiness, restless legs in the evening or at night. Should say if somebody has a standing profession, they're on their feet, may want to come home and elevate their feet. But it does progress over time into potentially skin changes around the ankle and ulcers. It can be a real serious condition. So just because it looks like just varicose veins, we really today want to encourage people to go see a vein specialist, communicate those symptoms, talk about their condition, and here's some of those, and that experienced vein specialist can connect the symptoms with maybe there is something significant going on underneath.
What is the cause? Sometimes you mentioned you have people that may stand up a lot at their job, and we've always heard that could be a condition. Is that true?
It is true. Can we go to the next slide?
Yeah, let's go to the next slide here, the venous disease.
So here we have on the left here, healthy vein, and if you don't know, in the venous system you have valves which return the blood flow to the heart, and that's what it should look like if it's functioning normally. If it's not, if the vein is damaged, or if it's become where the valves don't connect and can't lift that blood to the heart, it will start to pool in the lower legs, and that's what causes the heaviness, the swelling, itchiness, and so forth.
See, I would have thought when I hear that it's a constricting of the veins. It's not. It's the weakening of the valve area.
Exactly.
So you're not getting that full circulation.
Exactly. Yeah.
It's like the pumping mechanism.
Right.
Is
it's
just not
pools in the
operating.
legs, doesn't get to the heart, and that's where we get the symptoms.
And the risk factors on this, you mentioned one of the obvious is you have a job, maybe you stand a lot.
Correct.
But does have to do with your age, ethnicity, gender?
It could be some of these things. It tends to be more in women, but not necessarily. So men, we encourage to go and also talk with the provider. Age is a factor, but we've also had people 18, early 20s, early 20s, 30s. Could be the genetic history. If our parents had it, bad venous problems, then a lot of times then we get it. We get it too. Also injury, a sports injury, or trauma, accident. These things can contribute to early onset of venous issues.
Okay, and we're talking about your legs. Is it your lower legs more than likely, your calves?
The whole leg.
The whole leg.
Yeah, it could be thigh issue. Pain in the thigh.
Okay, the symptoms beyond the obvious of seeing that. What are some of the other symptoms? You talked about restless legs. Is there pain? Do your legs feel heavy?
Yes, very heavy, itchiness, aching, cramping. Any of those things can be just a sign to go and discuss that with a physician, because it's not normal, and you don't have to live that way. You don't have to feel that. It potentially is something that can be done about that.
Okay, so you do an ultrasound. The doctor does an ultrasound. Is that the first step?
Typically, yes.
Okay.
The ultrasound is, as you know, non-invasive. It's just an imaging study where the technologist is going to use a probe and pass it along the leg to visualize the venous anatomy and determine if there is an issue, where is it, and what may potentially benefit from treatment.
Okay, so this is where, when we get into the procedures, this is where Medtronic comes in, right?
Correct, yeah.
And let's talk about exactly what the procedure is and the devices that are used.
Sure. So our procedure is called the Venefit procedure. It's like benefit with a V, Venefit. Uses RF ablation, which is a fancy way of saying heat, to close down that vein that you saw that wasn't working. So we want to close down the vein that doesn't work to reroute the blood through venous vessels that do work.
Okay.
And we use heat through a catheter, which when you think of a catheter, just think of a thin tube or a thick piece of spaghetti. At the end is a heating element, and we close down that vein. So
literally shut it off?
We shut it off.
And so the body figures out another route.
Exactly, yeah.
Okay.
So typically blood flow, 90% of it goes through the deep system, and 10%, which is the part that gives us the issue, is what we're fixing.
And what if somebody has more than one vein that has a problem? Is that common where they may have 5 or 6 in each leg?
Well, it could be, depending on the severity of it, but yes, it could be 2, 3, 4 different veins. There's 2 great saphenous, 2 small saphenous, and then there's
Now,
other
as far
veins.
as the procedure goes, how long does the procedure take, and how long is the benefit of it? Is something that's has to be done every few months?
It takes about, think of it as a dental appointment or a lunchtime procedure, so about an hour.
So very quick.
Both, yeah. The ultrasound, it takes about 30 or 45 minutes. That's a separate appointment, and then the actual procedure takes about an hour.
Okay, and the benefits of this as far as long-term, and we see the pictures here of a dramatic difference 3 months later, but is this something that the person is basically cured at this point, or is it something that's ongoing?
It's pretty durable outcome. What we've shown is our 5-year data with the equipment is about 95% closed at 5 years.
Wow.
So it does need to be followed, and a lot of times this has happened it's progressed over a number of years, so might not fix it overnight. But typically, as you can see, patients will get relief pretty quickly. Yeah. And they're on the right path. So if they see a vein specialist, they can put them on a treatment program, and if there are issues in the future, they can follow up and have it treated. Yeah,
that's great. And as far as the way you mentioned the ultrasound, that's your the first thing that's going to be, you're going to get diagnosed with that. And then from there, another appointment is made where they can come in and have this done.
Correct. Yeah.
Wow. So 2 appointments, basically.
And that's it.
And you're on your way.
And we didn't mention at the end, too, it is covered in most cases by insurance, Medicare, and private payers, because it is a medical condition. It's not just a cosmetic condition.
That's great.
Yeah, so a lot of people don't know that it is, but it is.
That's wonderful. And as far as the device goes, you just mentioned again, it's like a thin kind of a catheter that just goes in. It almost seems as though like they're getting an injection into a vein. In other words, it's that simple, right?
Correct.
Yeah.
It's minimally invasive is what we call it. Used to be we had to go through a complicated surgery.
Yeah.
A lot of bed rest. Patients are encouraged to move about and be active following the procedure.
That's fantastic. Well, great news.
Good.
Thank you for coming on today.
You're very welcome.
And I want to tell the viewers here that if you feel you might have this problem, call Orange OC VeinCare and Diagnostic Center. Their number is on the screen there, 949-364-0080, and ocveincare.com. That is certainly a place that you can go, and they can check that out. So if you think you might have that, it doesn't hurt to get it checked out. So who knows? Don't let the condition get worse, and get some treatment from that. Thank you again, Paul.
Very welcome.
Nice to meet you.
Thank you as well.
And we'll be right back.
What if your legs could carry you through the day? What if your body didn't bear the signs of painful varicose veins? Take your first step toward treatment at OC VeinCare. Our treatments are in-office with no downtime. Return to everyday activities the same day. We gladly accept Medicare and other insurance. At OC VeinCare, life begins when the pain stops.